Hi, I'm Robin Shooter, founder of Empower Total Health, and this is my third update on the 5th International Plant-Based Nutrition Healthcare Conference, the PBNHC, which was held in Anaheim, California in September of this year, 2017. And in this talk, I'm going to summarize 3 of the conference presentations that focused on cancer. First up was Dr. William Lee's presentation, which was rather provocatively titled, "Can You Starve Cancer?" Dr. Lee's primary research interest is angiogenesis, the process of forming new blood vessels from existing ones. I covered his 2015 PBNHC presentation in which he discussed the role that's played by angiogenesis in a whole range of health conditions from endometriosis to rosacea in an article which you can find on my website. Check the link below. But this year's lecture was all about angiogenesis and the big C, cancer. As Dr. Lee explained, when cancerous tumours first begin, the damaged cells, the genetically damaged cells, divide so rapidly and in such a disorganized fashion that they quickly outgrow their blood supply. They just kind of pile up on top of each other. Without developing a reliable blood supply, a tumour kind of maxes out in terms of its energy supply. It can only reach a maximum size of 1 to 2 millimetres, which is clinically insignificant. It's technically cancer, but it's not clinically cancer. It's never going to kill you. However, once a tumour manages to secure a blood supply, it can increase in size by a mind-boggling 16,000 times in just a couple of weeks. How does the tumour supply itself with blood? By stimulating angiogenesis. Tumours release pro-angiogenic chemicals that cause neighbouring blood vessels to sprout extensions that grow into the tumour, feeding it with the oxygen and the nutrients that it needs to continue growing. And that's where diet comes in. See, most people think that cancer is primarily a genetic disease in the sense of being caused by inheriting faulty genes. But in fact, only 5 to 10% of cancers are genetic, which means the remaining 90 to 95% of cancers are due to environmental factors. And an estimated 30 to 35% of all cancers are linked to diet. There are multiple compounds found in plants that inhibit abnormal angiogenesis, thus preventing or slowing the growth of cancers to the point at which they become clinically apparent and potentially life-threatening. And these substances don't just inhibit angiogenesis in cancer cells growing in a petri dish, they do it in real-life people eating actual food. For example, genistein, which is an isoflavone compound found in soybeans in particular, has long been known to have anti-angiogenic properties. In fact, in laboratory assays, soy isoflavones compare pretty favorably to anti-angiogenic drugs like Avastin, which cost a lot of money and have some fairly horrendous side effects, but they do work as anti-angiogenic agents. Does that benefit translate to actually eating soy and other isoflavone-rich foods, though? A recently published study called Dietary Isoflavone Intake and All-Cause Mortality in Breast Cancer Survivors, the Breast Cancer Family Registry, found that among North American women with breast cancer from a whole range of ethnic backgrounds, those who consumed the most dietary isoflavones, not isoflavone supplements by the way, were less likely to die of any cause. Other powerful angiogenesis inhibiting substances occur in tomatoes, and cooking the tomatoes enhances the bioavailability or ability to absorb and utilize these compounds. Dr. Lee referred to a study showing a 40 to 50% lower risk of dying from prostate cancer in men who ate 2 to 3 serves of cooked tomatoes per week. The reduced death rate was due to decreased tumor vessel area and vessel abnormalities in the tomato eating men. That is, their prostate cancers were smaller and less vascular if they ate their cooked tomatoes every week. Dr. Lee also extolled the value of tea as a form of food as medicine, with black tea, sencha tea, Earl Grey and green teas all demonstrating powerful angiogenesis inhibiting activity. Interestingly, agitating the tea bag results in 15% more anti-angiogenic catechins in the brew, so don't forget to dunk your bag. An emerging area of research in Dr. Lee's field is the effect of the gut microbiome on angiogenesis. One fascinating finding is that eating one or more apples per day reduces the risk of colorectal cancer, bowel cancer, by 20%. And this risk reduction is partly mediated by the production of hydroxybutyrate by the gut microbiome. So the gut bugs actually ferment pectin, a form of carbohydrate that apples are rich in, and produce this cancer-reducing substance. Pretty impressive. Okay, on to Dr. Bharat Aggarwal's talk, and this was called Inflammation, Diet and Disease, Food Solutions. And Dr. Aggarwal took us really deep into his decades of research into the role of inflammation in chronic diseases, especially cancer, and the effect of substances found in common foods, most particularly spices. As he pointed out, dysregulated chronic inflammation caused by lifestyle factors mediates all chronic diseases, including cancer. It's one of those driving forces of chronic disease. Dr. Aggarwal actually discovered the inflammatory cytokine or cell signaling protein called tumor necrosis factor very early in his research career, and he found that it promoted the progression of cancer in human patients. Now, there's a wide range of drugs that inhibit tumor necrosis factor alpha that have been developed, and these are monoclonal antibodies. Drugs like infliximab, sold as Remicade, and adalimumab or Humira, and also circulating receptor fusion proteins such as etanercept or Enbrel. But the so-called active ingredient, I think this is a misstatement, there are lots of active ingredients in the spice turmeric, but the one that's most often called the active ingredient, which is curcumin, is a potent TNF inhibitor with an anti-inflammatory activity that's actually comparable to steroid drugs like prednisone, but without the laundry list of nasty side effects which really limit the use of these steroid drugs. The transcription factor, nuclear factor kappab or NF-kappa B, regulates 500 or more genes that are involved in inflammation. Excessive activation of NF-kappa B is seen in most chronic diseases, including cancer, and inhibiting NF-kappa B can prevent or delay the onset of cancer. Unfortunately, both chemotherapy and radiation therapy activate NF-kappa B, which means that they're feeding the inflammatory process that underpins the growth and spread of cancer, even while they're treating the current cancer that you have. And this probably explains why patients develop resistance to both chemotherapy and radiation therapy, oftentimes quite quickly. On the other hand, there's a wide variety of plants that possess NF-kappa B inhibiting properties, including traditional Ayurvedic herbs such as amla, guggul, frankincense, ashwagandha, pepper, and neem, as well as resveratrol, which we find in red grapes and berries and peanut skins, indole-3-carbinol, which we get from our cruciferous vegetables like cabbage and kale, and tocotrienols, which are members of the vitamin E family. So many of the foods that you can choose to eat each day are actually powerful medicines. And that brings me to the third presentation, breast cancer prevention and plant-based nutrition. Dr. Delia Garcia presented this talk, and she takes food as medicine so seriously she actually quit her oncology practice and now works as a health coach for women who are battling breast cancer. With decades of oncology practice under her belt, she had some pretty worrying insights into the cancer business, and it is a business. For starters, she pointed out that in most clinical trials of drugs, and this includes cancer drugs, there's now no longer a control arm in which the new drug is tested against an inert placebo, a sugar pill. Instead, the effectiveness of the new drug is compared to that of a drug that's already in use, which was most likely tested against another drug that was already in use, and so on and so forth. And a drug can be approved if its sponsor produces just 2 studies showing that it is not less effective than an existing treatment, no matter how many studies show the contrary. So you could have 6 studies that show that the drug is actually worse than the existing accepted treatment, but if you have 2 that say it was as good as, fine, you're in. Most of the blockbuster cancer drugs that cost tens or even hundreds of thousands of dollars each treatment cycle or per year, most of these drugs actually fail to show any real benefit in terms of what matters most to cancer patients and their families, which is, will I live longer if I take this drug? And will I live life in a state that's actually worth living? That's really what cancer patients want and their families. Secondly, Dr. Garcia warned that women with early stage breast cancers are being overtreated. Back in the 1980s, women who had small, slow-growing breast cancers that were estrogen receptor positive and lymph node negative were given minimal treatment, just a lumpectomy in most cases, but the cure rate was 95%. Now, women with these low-risk tumours are usually treated systemically with chemotherapy and also with radiation therapy. And this overly aggressive treatment puts them at risk of serious complications of treatment, including suffering heart disease from radiation therapy for no benefit, no greater rate of survival. Losing a breast is psychologically devastating to many women, but Dr. Garcia pointed out that breast cancer survival rates in women who've had a lumpectomy are as good as survival rates for mastectomy in most cases. She also echoed Dr. Lee's point that our genes play a relatively minor role in cancer, explaining that only 5% of breast cancers are attributable to the very well publicized BRCA gene, and less than 1% of the general population carries these BRCA genes, although about 2% of Ashkenazi Jews are carriers. Family history does play a role in breast cancer, though. A woman's risk doubles if her mother or sister or daughter has had breast cancer. It triples if she's had 2 relatives who develop breast cancer, and it quadruples if she's had 3 or more relatives who develop breast cancer. But there are many things that women can do to reduce their risk, including, number 1, maintaining a healthy weight. Obese women have twice the risk of breast cancer as women in a healthy BMI range. Gaining just 5 kilos leads to an 11% increase in breast cancer risk. Second, being physically active. Sedentary women have a 25% higher risk of developing breast cancer, and a meta-analysis of 70 studies found that exercising regularly reduces the risk of dying of breast cancer by 40%. 3, avoiding alcohol. Even 1 drink per day increases breast cancer risk, while 2 to 3 drinks per day raises your risk by 20%. 4, avoiding HRT, and 5, avoiding statin drugs. Women taking statin drugs to lower cholesterol for 10 or more years have double the risk of invasive breast cancer as women who've never taken statins. What about for women who've already had breast cancer? They can reduce their risk of recurrence by 25% by consuming a cup of soy milk or a half cup of tofu or a cup of edamame each day. So soy foods, in other words, traditional soy foods like tofu and edamame, prevent breast cancer. They do not cause it, and they are perfectly safe, in fact advisable for women who've already had breast cancer. And these women should also cut back on fat. Dr. Garcia cited a trial which found that women who dropped their fat intake from 40% of daily energy, which shockingly is around about average, to 20% of daily energy, reduced their 5-year breast cancer recurrence rate by 24%, even if they had one of the less favorable tumor types, an estrogen receptor negative tumor. My favorite quote from Dr. Garcia's presentation was this one: "People do not decide their futures, they decide their habits, and their habits decide their futures." And practicing just 5 habits can lower a woman's risk of breast cancer by 30%. Don't smoke, drink very little or no alcohol, maintain a healthy body weight, don't use HRT, and walk 30 minutes a day. That's it. That's all you need to do. Talk about a massive payoff for a very modest investment. So please share this information on dietary prevention and possibly treatment of cancer with food with everyone you know. I don't know anyone who doesn't have some concerns about developing cancer. So if you like this message, like this video, then share it on your social media networks. I'll catch up with you for next week's weekly update.